Starting the recording. And it doesn't want me to start this recording. Oh, 1 second. Okay, now I've got the recording and the transcription started. Wonderful, wonderful. Well, thank you folks for joining. I think we're going to be a relatively small group today, so we're going to go ahead and get started. So my name's Liz, for folks that are streaming, it might not know now, and I'm with the Department of Aging. This is our final meeting of our stakeholder advisory group, and it's our final meeting of our work group recommendation process. So congratulations to all of us for getting here at this stage in the process. So I should be sharing my screen. Let me open it up. All right, wonderful. So thank you everybody for joining today. Our next slide. So today we're going to discuss the process that we are completing, this sort of recommendation process stage that we're in within our plan. We'll review the recommendations. We'll discuss this group's reactions to those recommendations. And then we're going to talk through next steps for the implementation stage, or for the planning stage, the drafting of the plan, the implementation stage, and that includes sort of next steps for this group, the stakeholder advisory group. So that's what we're going to take care of today. So as a reminder, here is the vision that we're really trying with this plan to begin turning into a reality. So our vision is to transform institution systems and norms so all older adults lead lives that are healthy, financially secure, socially connected, and purposeful, acknowledging that we are really planning for the 100-year lifespan, which of course is much different from what we were once planning for with aging services programs. So here's what we aim to do in this work group process. This process was really intentionally aimed to center our process of developing recommendations on the experiences and needs of Marylanders, taking a bottom-up approach to developing recommendations. We aim to bring sectors together with representatives from communities and sectors throughout our state. We started with what's going on in Maryland and across the country to try to avoid reinventing the wheel and instead to build on what's already here. And we focused on state government level strategies. You can see here some of our process points, or what we were doing, right? We had 4 work groups that consisted of members of state agencies and commissions, local government representatives, self-advocates, experts in aging, academics, philanthropists, private businesses, members of organized labor, and community-based organizations. So we had over 100 work group members, 4 work groups. We had 15 subgroups, some recommended by the Maryland Department of Aging through our definition of priority areas, and some were developed by the work groups themselves based on what they thought was the most important thing to discuss. We encouraged work groups to develop their own processes and plans to identify and develop recommendations that would have the greatest impact in Maryland. And we tried our best as staff to make that easier by doing things like taking notes, scheduling meetings, summarizing findings, and making recommendations. We also use Notebook LM, which is a Google tool to help us with meeting notes and analysis throughout the process. Many of our work group members brought in guests to fill in gaps in knowledge and representation and to ensure that their discussions were robust. There were different ways that work groups facilitated concentrated discussions around these subgroups. All work groups took advantage of the breakout room option, and many decided to meet outside of the scheduled work group meetings as well to collaborate. Members worked together on shared documents within and outside of the Google Drive that was made available. Meetings were made available to the public and still are. And we had over 700 views of the live streams and recordings on our YouTube channel throughout this process. Following this meeting, you'll receive a link to complete a survey telling us how we did with this process and what we can do better. So this is new for the Department of Aging, not for every organization, but it's pretty new for us. And we certainly recognize that we had hiccups along the way. Things really didn't always work out the way that we anticipated. But what is definitely true is that the people that participated in this process brought their knowledge and their passion to the table and developed comprehensive and impactful recommendations for the state to review. We are extremely grateful to everyone involved in this process for coming to the table and sharing your time, experience, and your expertise to develop these recommendations. It was a lot to do in a really short, concentrated time. And we should really, I think, all feel proud for getting to this process. And I really, really do thank you for being part of it. All right, so let's dive into our recommendations. All right, so here are some overlapping themes across all the strategies. What we're going to do is kind of do an overview of what we have here and then ask members representing the work groups if they have anything that they want to add to this analysis that we're sharing. So we'll kind of, through that get to where we're going. I shared beforehand with members of this group the recommendations, both kind of a simplified version that just includes the objectives and the strategies, and a more detailed version that includes all of the supporting information. Of course, it's a huge amount of information, right? So the detailed version is more than 50 pages of writing at this point. So we don't expect you to have reviewed it. We do want to talk about the overview of what we got out of those recommendations, and then we'll talk about next steps as well. Okay, go ahead, Cheney.
Yes, I'm sorry to interrupt. I think there's been a bit of confusion on our end in terms of the date, because I was under the impression that we were to submit recommendations by the 15th. And so you will not see ours today. I can tell you what they are, but I think our wires just got crossed in some of
Cheney, we have yours. Cheney, we have it. We've got the overarching things. We could still write kind of some of the strategies, but we have the overarching from your group.
Oh, okay. Let me hush then. Thank you.
You're way ahead. You're good.
What we had is that, most of our groups really focused on getting their recommendations in within all of their subgroups to their main group by last Friday, so that this group would be able to review an analysis of where we are across the board. Now, one of the first questions I'll ask you when we move to next steps is, what are we doing from here? So we'll get there.
Okay, thank you. I'll hush.
Thank you for asking questions. All right, so some overlapping themes that we found. First, collaboration and partnership. As we would expect, many of the strategies emphasize the importance of collaboration. The theme is especially evident in recommendations for the longevity ecosystem and the promoting economic opportunity for all, but it's really across the board. Partnerships that are specified involve government agencies, community-based organizations, older adults and their families, and address both public and private sectors. Funding and resource allocation. Securing adequate and sustainable funding is crucial for the success of the identified strategies, and several strategies focus on identifying funding sources, advocating for policy changes to support funding, and optimizing the use of existing resources in place of new funding. Resources specified are not just funding, but also include things like technical assistance to ensure capacity building of local organizations. Strategies related to affordable housing and transportation services are really good examples of this. Education and awareness. Raising awareness among the public, stakeholders, and service providers is a really recurring theme across the work group areas. We heard again and again in our conversations that there are programs and supports, but people don't know about them, and they're siloed, so they're not talking to multiple target groups at the same time. Strategies across multiple groups call for developing and implementing educational campaigns, engaging in training and creating training programs, and outreach efforts to promote understanding and utilization of available services and resources. This is demonstrated in strategies related to age-friendly workplaces, long-term services and supports, and brain health. One example that I saw across groups, for example, is better utilization and development and sharing of the No Wrong Door concept, building on top of the Maryland Access Point Aging and Disability Resource Center. It's included in strategies across groups, even though we do have an LT, a long-term services and supports access group. It showed up in multiple places. Technology and innovation. Harnessing technology to improve service delivery and connect older adults with resources was another prominent theme. Strategies related to developing online platforms, utilizing AI and technology tools, and promoting telehealth really did highlight this focus across work groups. And then the last one here is equity and inclusion. Ensuring equitable access to services and opportunities for all Marylanders, regardless of background or circumstance, was a crucial consideration, as was really targeting resources to communities that have been under-resourced in the past. Recommendations include considerations for addressing disparities and ensuring cultural competency. This theme is embedded in strategies addressing diverse needs in housing, transportation, and healthcare. And there are several strategies that focus on empowering communities and ensuring accessibility, including through things like simplifying application processes. So these overlapping themes really underscore what we hoped would be part of this process, which is a holistic approach to preparing Maryland for a future where people live longer and healthier lives. All right, here were our EPIC goals, as I'm sure you're very familiar with them now. So this analysis, we're kind of going to go goal by goal, and I'm going to do the overview and really ask members to kind of fill in the gaps as you'd like to share with them with the group. All right, so here's our overview of recommendations. The first being build a longevity ecosystem. This work group that was focused on this area developed 4 subgroups: supporting local governments, supporting grassroots organizations, facilitating multi-generational relationships, and age-friendly. And key themes that we found across groups here were strengthening collaboration on the local level, increased awareness, and equity and inclusion. And increased awareness included things like mapping and marketing across groups. So the strategies for building a longevity ecosystem focused on fostering age-friendly communities, establishing robust support networks, promoting intergenerational connections, recognizing the importance of community-based organizations. The strategies included building a strong network of hyper-local organizations. Hyper-local, we actually got a definition of from one of our groups, and that term kind of kept coming up throughout the work groups as well. And doing this building of a strong network through asset mapping, through engagement, and supporting older adults through capacity building of community-based organizations, transparent and collaborative resource allocation, technology utilization, and awareness building. The recommendations emphasize supporting local government through investments in marketing and promotion and staff, creating a shared understanding of available programs and benefits, collaboration to increase access to services, and building on existing technology at the state for training and for convening and for increasing coordination. The recommendations also promote intergenerational connections by building awareness, providing training, mapping programs, advocating for policy changes, developing targeted awareness campaigns, creating an online platform to map resources, and promoting intergenerational initiatives through policy change and demonstration projects. Finally, the strategies emphasize creating age-friendly communities across the state by securing commitment from officials, codifying through legislation, providing information and resources for local implementation, and especially engaging in collaboration with area agencies on aging. All right, do we have a comment or a question? So, Allison noted a gap noticed in addressing ageism. We should in some way include public school system and work to incorporate ageism awareness into existing curriculum for elementary, middle, and high school. Didn't see any mention of working with school-age children. It's a good gap to notice, thank you. Anyone else from I was part of the longevity ecosystems group. Anyone else that was part of that group want to fill in any gaps from the analysis that you think are important for this group to know?
This is John, just from the supporting local governments work group. We also advocated for increasing resources in certain areas. One was to call for investing in and expanding Maryland Access Point coordinators. We also talked about convening a collaborative group of statewide and local stakeholders to talk about how to support longevity services by increasing or focusing on workforce strategies. So I don't know if other subgroups had that in there, but under key themes, I think maybe increasing or enhancing resources might be something we'd want to make sure is addressed or mentioned.
Thank you. All right, let's go to the next one. Okay, promoting economic opportunity for all. The recommendations aim to bolster economic security and inclusivity for Marylanders across the lifespan. The recommendations focused on recognizing the economic contributions of family caregivers and supporting them in their role by enhancing support systems, expanding respite services to increase resources for family caregivers, and increasing awareness of services and providing training. So sorry, overview. I kind of just dove right in there. Overview here. We have these three subgroups: employment for 50 plus and multi-generational workforce, talking about both of those at once, family caregiver and the direct care workforce. And you can see these key themes here: recognizing the value of paid and unpaid workforce, prioritizing workforce development and equity, and age-inclusive workplaces. So you'll hear that as we're kind of talking through these details. The recommendations also promote enhancing compensation for direct care workforce by advocating for living wages through policy reform and regulations of employer settings, improving training opportunities, establishing clear career pathways, and connecting consumers and direct care workers. Strategies promote age-inclusive workplaces and support older workers through employer education, resource development, and information sharing, increasing the adoption of age-friendly workforce certification, as well as related data capture and sharing. And finally, the recommendations focus on improving employment outcomes for older and multi-generational workforce by collecting and analyzing data, policy development, creating intergenerational workplace resources and opportunities, and incentivizing entrepreneurship by older Marylanders, as well as developing and testing career pathways. Anything that anyone from this group wants to add? Maybe things that weren't represented here, Taney, for example, that you know are coming.
Not particularly. I apologize again for interrupting earlier, but I think that for our working group, and I was co-leading the direct care workforce group with Meg Laporte. Our two objectives primarily fall around the income and wages, but also around increasing the data and awareness related to understanding who the direct care workforce is and finding innovative ways to link family caregivers and persons that need services directly to direct care workers, especially in the coming years. But those are the only two things.
Thank you. Sean, I see your hand is up.
I just thought one thing I didn't see in the longer report was any reference that time to care legislation. And if we're looking at family caregiving and trying to maybe maximize the impact of this new insurance program in Maryland, that we might want to specifically mention it somewhere in our plan.
I can speak to that a little bit if you want, Liz.
Please.
So one of the things about legislation, Sean, and we felt it was important, is we in this, and again, some of these, strategies we're still batting out, which is Liz is going to talk about at the end, but this LRM definitely wants to continue to get behind Senate Bill 202, and things like that. As far as the paid insurance, that was an interesting one. And we did talk about that, but we also at the same time have the Maryland Commission on Caregiving. And so kind of built into LRM is to continue to support the Maryland Commission on Caregiving, which I think is going to pick up that one a little bit more. But so it's kind of baked down in there a little bit, Sean, but we talked about that a lot. And I agree 100%. It's a big part, and it's going to be a big part of the economics of Maryland in years to come. Once we figure it all out. So, I will make sure that it is, kind of pulled out a little bit more. I agree. It's big. It's a big one. It's a big part of this formula. So.
And Allison, your comment about in this section, maybe a gap is including continuing to ensure an increase in Medicaid reimbursement rates overall. There was a recommendation for wage pass-throughs, but a focus on ensuring increase of Medicaid rates overall may be important. That's something to note as a gap. Thank you.
Can I just respond to that really quick? Because this is something that we discussed quite a bit in our group, and I think that there were hesitancies to include increasing reimbursement rates because it seems to be quite a heavy lift to do. And so the wage pass-through was sort of our way of sort of at least addressing reimbursement and ensuring that wages are at least going where they can in terms of the direct care workforce. But I will bring that back to Meg as well, because that is something that we had talked about as a group. Thank you.
Thank you. All right, good. Let's go to the next area. All right, so the next area is preparing Marylanders to afford longevity. This was a huge group, big focused subgroups included in affording healthcare, affordable housing, long-term services and supports, access, and financial planning. And there are some key themes across these groups that we noticed in the analysis: prioritizing accessibility, equity, inclusion, and multi-sector collaboration. So kind of what we would assume through this process. So the Prepare Marylanders to Afford Longevity strategies aim to improve the financial well-being of older Marylanders as they age, focusing on these areas that we've identified. The strategies advocate for expanding access to affordable health care by reducing hospitalizations through advocating for more comprehensive Medicare coverage, promoting awareness of cost-saving programs, focusing on upstream interventions and prevention, including a strong focus on behavioral health systems reform, home and community-based services, and primary care. To address housing affordability, the strategies propose committing resources, both funding and tax credits, to meet the needs of older adults, partnerships and initiatives that create and preserve affordable housing options, and including with the integration of supportive services, including things like home modifications, healthcare, and transportation. The strategy recommended strategies also call for enhancing access to long-term services and supports by simplifying the application process, reducing wait times, and raising awareness of available services. And finally, the strategies for financial planning include promoting financial literacy education throughout the lifespan, increasing access to financial guidance for people, and really with a focus on starting early, and promoting age-friendly workplaces and incentivizing the over 50 workforce. So some overlap with the last group as well. Anyone from this group have anything that they want to add? Go ahead, Sean.
Sorry, not from that group, but I want to give voice to one of the concerns of an advocate in Montgomery County that Longevity Ready Maryland somehow address fraud and financial exploitation. Because if you're talking about financial security, but someone who's saved their whole life, but then as an older adult, their resources are scarfed from a bad actor. So we need to, I think, acknowledge that is it's a reality and it's a worry for a lot of people.
Thank you for bringing that up. I know one of the things I was going to mention later in our next steps is sort of where we go from here includes looking at recommendations that might be coming out of different conversations. I know there's sort of an elder abuse task force going on. I'm not sure how much that has included a focus on that issue at all, but that was one of the places I think we were aiming to look.
It's a very large part of that particular. It's a governor's task force, which is has a whole subcommittee of elder abuse and of fraud and financial schemes, financial fraud. So they're working on their own plan at this time. So I think we do have somewhere in here is kind of like I said with the Maryland Commission on Caregiving. This particular task force has been going for about a year now, and I think we'll have its recommendations to the governor. I think it's by the end of December. And so part of Longevity Ready Maryland is to support, and I know with NDOA, we've been in close contact with all of what their recommendations are to continue to support that too. So that is in play, at least that way.
Thank you for sharing that. Anne, go ahead.
Hi, so I'm going to speak both for myself and for Dan Martin, who is on the Affordable Healthcare work group. And I just noticed that there was I wanted to highlight one of the strategies that came out of both the Affordable Healthcare and the Brain Health work group was the importance of early screening and referral to treatment, especially for behavioral health. And where that screening can be done is a wide variety of places. But if we want to, both promote healthy lifestyles and reduce down the road costs, if we can intervene, or if we can screen and intervene early, and by providing services, we reduce costs overall. So that was a strategy of both work groups that I noticed and just wanted to emphasize.
Wonderful. Thank you. Anyone else have anything to add here? Okay. All right, let's move on to the next one. So for optimizing health, wellness, and mobility, we had, again, 4 subgroups. Person-centered care, which, as you can see here, was a key theme across groups, and there were kind of concentrated recommendations specific to person-centered care. Brain and physical health, transportation, and social connection. Key themes included person-centered approach, access and empowerment, coordination, prevention to address social determinants of health, and technology solutions. So this work group strategies aim to support the well-being of older adults by promoting person-centered care that empowers individuals, integrates services across disciplines, and addresses social determinants of health. The recommendations prioritize comprehensive trauma-informed brain and physical health services through an interdisciplinary process, focuses on prevention, early intervention, and access to a range of resources, and one that's specifically named, for example, is Care Navigators. Recommendations around brain and physical health focus on collaboration and community-based organizations, local providers, and state government. Person-centered care, like I said, has its own recommendations that draw upon existing person-centered planning guidelines, utilizing a family partnership model, providing home and community-based services options, and allowing for person-centered and shared decision-making, peer support, and access to technology. The strategies highlight the significance of social connection, advocating for connected and inclusive communities, promoting social engagement through policies and programs, and addressing social isolation through targeted programs and initiatives, awareness building, and effective communication strategies. Finally, the strategies advocate for accessible and safe transportation options. Emphasizing age-friendly design in communities, building upon that age-friendly design should really be built upon community engagement, so engagement of people that are impacted by the access to transportation, looking at opportunities to increase collaborative planning between state agencies to support age-friendly design and options, and leveraging technology to enhance mobility and increase awareness of services. I think I heard some comments already coming in about gaps. Let's see, looking at food insecurity, nutrition services, and food as medicine. Stephanie noticed she's not heard this in any of the priorities, but it's most relevant here in relation to health and wellness. I agree, Stephanie. That's another one of sort of the next steps is this plan also acts as our state's state plan on aging under the Older Americans requirements. And we have some really specific language that we want to include related to addressing malnutrition, and things like food as medicine through home delivered meals and medically tailored meals as well. So if you have specific recommendations on that, Stephanie, because I know that's your area of expertise, we would love to hear them as well. And I can share with you some of the things that we've started thinking through. Other thoughts? Oh, I also see a comment here under transportation. Good to add something about older drivers. Any other thoughts? Anything from members of this group that you want to kind of fill in on the analysis that you think maybe wasn't touched on, or maybe is a gap that you want to highlight?
Hi, I'm Brenda Sellis. I'm one of the members of this work group. We did talk about using senior community centers / senior rec centers, specifically in Montgomery County, but not exclusively there, for how we could empower, educate, et cetera, employees that work there to be able to know how to connect seniors to all of these resources. Because that is a wonderful place where they do interact with each other, and sometimes they are isolated. So exposing them to what is also available, we wondered how that could be done.
Okay. Other thoughts? Sorry, I'm working with multiple screens here. Let me see what I put in here. I also have a comment about nursing home and ALF oversight. Anyone from the group have thoughts about how either the items are or could be included that have been discussed? Okay. All right. So moving forward to kind of overall reactions. This is sort of what do you think? And here are a few questions to get us started. Does this sound accurate based on your experience in the groups and the opportunities available in Maryland? We've heard as we have gone a couple of ideas for where there might be gaps that we need to look at. Are there important initiatives, resources, or strategies that you think might be missing or should be further emphasized? And are there other ways that you would suggest we structure these recommendations, given the information that's here, right? We've put this process forward with our goals at the top and our work groups coming down off of the goals, but maybe folks have other ideas, having gone through this process, having seen this analysis of how we might want to just think about the structure of the objectives and recommendations. Anyone want to get us started? Sean, go ahead.
Sorry, but God forbid I let there be silence for long. I just think that it is a lot, and they're wonderful, and it just, I'm concerned about overwhelming, like people were trying to get buy-in from, for example, state department heads, for example, that looking at all of this. So I just wonder about prioritizing among all these great ideas and maybe not including all of it.
It's a concern I have as well. So you might have seen that in the process points that we had. What did we end up with? 16 objectives and 121 strategies and actions. I think many of which are overlapping and are something we can think through. But I agree, and I think that's sort of a next step for us at the Department of Aging. But I'm interested in feedback from this group as well on Sean's point here.
Well, Liz, I'll just add, kind of with that, and I think we struggled, if in the work group, you'll see within our strategies, the overall objective might be one thing, but there's so many, the strategies are kind of where the rubber meets the road, right? And then we had to kind of say, what's going to happen in the 1 to 3 years? What's going to happen 4 to 7, et cetera? Sean, just like you said, we can't get all of this done. you know, and nor do we have to get all this done. Let's get something done, but let's also, and I will go back to our secretary's, you know, just vision here is this is a plan. You know, this is where it kind of starts, and we have to make the plan fluid, and we have to make it in a point that it can pivot. If we get hit with another pandemic, we're going to be doing different stuff. But what is already happening that we can grow upon? What is not happening but needs to happen that's going to start from ground one, you know, level one? That's going to be a much bigger pull, you know, or what is currently already in place, such as you kind of talked about the, you know, the oversights of assisted living and nursing homes. Well, that's already going on. And does it mean that the system's perfect? No, whatever, you know, then I'm going to say, that's not our wheelhouse, right? So I want to stay in mind, but it doesn't mean that it's not part of maybe saying these are things that are factors in this entire formula. So, you know, this is a 10+ year plan, because and a lot of this, and I think, Liz, to what you'd said earlier on, is a lot of this is just gathering data. It's going to take us a year or two to gather some of the data that we need. Data makes people move in Annapolis. So we got to have proper data that's Maryland based versus national data. So I think I know within our large group and even within the subgroups, it's so hard for us not to make everything a priority from 1 to 3 years. And then we kind of said, well, there's no way. we can't all 4 groups, 121 strategies get this done in 3 years. This is not going to happen. So to be a realistic plan, which, you know, Liz, you kind of said, it's kind of our challenge now. And certainly we look to the expertise of others is, you know, what is realistic? What has to happen now? What has to happen to get to that particular thing? And just everyone to remember, this is a plan. This is going to come out on paper. And then the execution of it is the critical part of it, is making sure that is, you know, fluid and, you know, and gets things done kind of thing. So the plan.
Thank you. A couple comments that came into the chat. Tying together clearly all areas of overlap would be helpful. And an approach of going for the low-hanging fruit to show success and build upon that might also be one strategy. Anyone related to those comments? Does anyone want to build on those? And if not, I think we had a hand. And you had your hand up.
Yeah, I mean, I agree absolutely that it's going to be critical to try to synthesize some of these strategies and collapse them as that can be done. And maybe I'm getting ahead of myself, but is there going to be a process here where the Department of Aging folks at the Department of Aging work on that, and then work group members again can look at that and respond? Is that going to, I mean, are these work groups going to be convened again?
Yeah, we're going to get into next steps.
Okay.
Let's focus on reactions first. Stephanie, your hand's up.
Yeah, I mean, I was just going to add about the 121 strategies. I think my experience with strategic plans is that the strategies really are difficult to plan that far out, that 10 years out, right? So if we really think that we're getting the objectives right, the strategies will come, you know, or we may need to be more flexible with strategies as the plan evolves, because that's really, it's been my experience that that's where you're sometimes, if you get so locked into strategies that you might miss the goal entirely because you're so focused on making sure you complete the strategy rather than achieve the objective.
Thank you. Thank you for sharing that perspective. Other thoughts, other reactions? I see a comment. Another potential gap is to how to ensure primary care physicians are equipped and incentivized to connect their patients with necessary resources and supports. Do you think we have at least a strategy around that? I think in the affording healthcare area. Yeah, and another question in the chat about whether we've used AI to synthesize and combine areas that might be a helpful exercise. We have used AI throughout this process to help us sort of begin our analysis, and then, we confirm and build upon that. So we've done some of that throughout the process and sort of had a check-in. I haven't gone through the process. I'm not sure if any of the groups of asking an AI tool to actually combine any of the recommendations that's been developed, but it's a consideration. It's an interesting consideration. Yeah, and I will say AI as a resource or tool has been called out by within several of the work group strategies across different groups. And I do think we as state agencies are early in our process of just understanding what the options are. Other thoughts, questions, comments? Anyone have other reactions related to these questions that you see in front of you? Okay. All right, let's move forward. So here's our timeline overall. This right here, this meeting is a huge milestone for the development of the plan. But again, it's really just another step in a long process. So let's talk about next steps that we're going to take here. So first, next steps on drafting. So you can see we've got the drafting period kind of goes through March when it's going to be open for public comment. So as an option for the group, we have the remainder of the week here. We've asked you, as Cheney noted early on, we gave you guys until November 15th. We meant that. And we wanted to make sure that we were checking in with this stakeholder advisory group before that date to say, how are you feeling? How are things going? Here's what we're seeing. Is that what you're seeing too? So we do have an option for this group for the remainder of the week. Do we have any volunteers that would like to do a final review for redundancies, gaps, basic language, grammar edits? It's a really big ask in a really short amount of time. So we're not asking you to do that or expecting you to, but does anybody want to volunteer to take that on? Really looking across the recommendations and taking a look at adaptations for the full group's recommendations. So you can let us know in the chat, or you can raise your hand, or you can email me afterwards. But I won't be surprised if we don't get volunteers. You guys have given a lot of time and expertise to us already. Okay. So next steps, it's our turn at the Department of Aging to review and edit and consolidate and add aspects. So we kind of talked about that a little bit already, but this really includes the Department of Aging reviewing overlaps in sort of the recommendations themselves. So for one example, in the longevity ecosystems group, which I participated in, we've got recommendations in multiple objective areas that are about asset mapping, that are about sharing, developing marketing strategies to target under-resourced communities to make sure that folks know what's available, and different things like that. So there's a lot of the same types of activities across different objectives. I think there's an opportunity to look at that holistically. Sorry, I saw a comment come in the chat. I want to address them as we go. Yeah, so Sean, you asked, has anyone put the objectives and strategies in the Excel document? I don't think we're there yet. We have put them into a Word document. I think sort of tracking is next stages in implementation. So we've got a lot of steps left in this process. So the first step is for us at the Department of Aging to do that reviewing. Like I've mentioned already, this is also going to be acting as our state plan on aging under the Older Americans Act, and there are lots of requirements associated with that. So a lot of them we are intending to bring in recommendations that are being developed by this group that Leslie was mentioning earlier. We've already hit on some areas that we're not seeing, which Stephanie kind of mentioned as well, things like nutrition. that we're going to be kind of looking and cross-referencing what we're required as a state to develop and making sure that that's represented in the overall plan. And what we're so excited about, doing that combination, which I think is new, I don't know if other states have done that so far, but that's not the typical process. Typically, you have your state plan on aging over here, and you have your multi-sector plan on aging. What we recognize is that the Older Americans Act is one funding source with regulations that's intended to be part of a much larger system of care for older adults. And so we're really grabbing hold of that and saying, let's streamline this. Let's not create separate plans that are really aiming to do the same thing. So we're trying to do that. And it might be a little bit trial and error for us. So we're going to see how that works out. But that also relates to why we have over here in our May and June part of our timeline that the plan is submitted to our state and federal leaderships. We have 2 reviewers and approvers for this plan. So I mentioned that. Okay, sorry, let me catch up with where I am. Okay, so we are also in our kind of early stage in the next month or 2. We're going to be convening cabinet secretaries to review the recommended strategies and ensure that state leadership understands what their agencies may be responsible for, right? What we're kind of assigning to them, and that the plan builds effectively on their work and is, sorry about that, realistic to sort of what they can and are able to achieve. Now, we feel pretty good about that because we've been having conversations as we go. We have lots of members of our work groups are from state agencies, and we've been having those conversations. So we feel pretty good about it, and yet it's an extremely important part of the process to vet these with our partners and make sure that the work that we're saying we want to do as a state is realistic and actionable. Then we want to come back to you guys, to our work groups, to the people that have participated and raised their hand and given their time. And we want to share where we landed with our objectives and strategies, right? We've gone through this review process, we've added things, we maybe consolidated things. Does it still look like something we all agree represents the needs of our state and, builds upon the opportunities within our state? So we'll be reaching out to you. It'll probably be me as the main contact to sort of everyone who is part of this process and applied to be part of this process to join us in virtual town hall events. So we'll be doing kind of this same thing, but internally again, and with our adapted versions, basically come back and saying, did we get this right? And we aim for that to be in January. So we'll be kind of previewing and getting your feedback on the plan. And then the plan is going to go through additional review and drafting, embedding all of the information we're required to embed with our requirements. Also we're going to be asking our partners at the National Center to Reframe Aging to review from their perspective and some other target groups as well. We're very interested in friendly reviewers and editors as well. So if you know someone or if you are someone who is a great writer and you want to, help work with us on that process, what's important for us is that we don't develop an entire plan because right now we've got the recommendations, right? The goals, objectives, and strategies, but there's a lot more that comes into a plan. There's a lot of context that we're going to be adding into that, data that we'll be adding into that. What we want to make sure that we don't do as a Department of Aging is come out with a plan that makes a heck of a lot of sense to us, but the context doesn't make sense to anybody else. So it's helpful for us to have people that are not embedded in the everyday work of the State Unit on Aging to be able to help with that review. So if you're interested in that, you don't have to raise your hand here. You can email me separately, or you can feel free to raise your hand here. And then we come to our public comment period in March. That's when we get this out there, right? We're sharing it with everyone who has been part of this process or has not been part of this process to say, here's our plan. What do you think? And we're going to be doing a couple of then targeted town halls in person. We'll be doing a couple of virtual that are much broader in their targeting. And we'll also come out with a toolkit so that folks can have conversations within their own groups, whether they're on a commission or they have, a group that meets together at a community center that might want to have that conversation. And there'll be multiple ways to give us feedback. So we had kind of been aiming for that to be in January. We found some time and pushed it back to March to make sure that it was going to be more accessible not buried right at the start of the legislative season, for example, when many people are very busy advocating for policy in our state. Then we incorporate that information into the analysis and make edits, and we're going to be doing translations at that point as well, so that the plan is available in multiple languages. And then it goes for state and federal review and approval. And then that's the start, right? That's our plan. The plan is developed. So then we have to get into implementation. So you can see this here, July 2025 to December 2035. It's a 10-year implementation period. So during that, we really start with getting the plan out there, sharing information about what it is, how it can be used, continuing to share information about Longevity Ready Maryland in action to spread awareness of local programs and resources and opportunities that are in development. We're very interested in some form of kickoff summit. That's something that I'm working on now. And if you have thoughts about that, I'm very interested in them. So please contact me. We'll be continuing to use our newsletter as a way to share information. We'll be looking to create learning opportunities like webinars and in-person convenings to really facilitate partnership building and share best practices, as well as share progress towards our intended outcomes within this plan. We'll be working to continue relationship building with state agencies and local organizations. We've really started that process, and it's going to be really integral to the implementation of any strategies that we have partnerships and that we know who we can ask for certain pieces of information and can kind of stay in the loop on how things are moving forward. Some of the things in this plan are targeted at the Department of Aging. Many of them involve other people that have far more resources and much larger networks, and we're very excited about that. And part of the implementation plan is an ongoing stakeholder advisory group. So many of you asked early on, what's the end date for this group? Are you just asking us to be in 4 meetings? And we didn't really have a solid answer. We're still trying to figure that out. But we do want to continue to convene a stakeholder advisory group. We'll be working over the next months to really review the group makeup and identify ways to increase our diversity, fill some gaps that we have now in areas that are outlined within the executive order where we have some relationships and we think we can grow as well. And we're also going to be looking to consider ways that we can or should formalize sort of seats in the group, right? We've got target sectors and target populations that are outlined in our executive order, but there's not specific organizations. Now, whether and how we should formalize that is sort of a question we're looking through. So we're extremely grateful to everyone who's participated in this group, and we will follow up with future steps as well. And then the last item I'll mention is that we have annual reports as part of this. So annual reports are required as part of the executive order. And they'll be released in January. So that's one way to stay involved in our progress. We also have a data dashboard that we will be releasing soon for public review. It has a lot of data from existing core data sets, and we'll be then building it out to be a progress tracker and include sort of the key metrics that are involved in the objectives and strategies here. So that tells you a bit about what our next steps are. To close it up, does anyone have any sort of last thoughts, recommendations on anything that we've shared here? Go ahead, Anne.
Yeah, sorry. I guess I'm still not entirely clear. Is there going to be a step where work group members, before the public comment period in March and April, is there going to be a step in there where work group members are going to review the draft plan, or are we going to be able to comment in March and April when there's the stakeholder?
Yeah, so as I shared, we pushed our timeline back for open public comment, and we're reviewing then. We're going to release this back in internal town halls to members who have been part of the work groups in January. So keep your eyes on your email. We'll be sharing those opportunities soon.
Thank you. That clarifies my question.
Other questions, thoughts? All right. Well, we'll be sending out that survey after this. Please do respond. We really appreciate your feedback. It'll be anonymous. You can share whatever you want with us. And thank you very, very much for being part of this process. We'll be back in touch by January. Have a good one.